KU. Wacha tuende kwake Lilian Muli aweze kuzungumza pamoja na wataalam, madaktari wanaohusika na masuala ya saratani, halafu turejee hapa kwa mawili matatu.
Many thanks once again, live from the Kenyatta University Teaching, Referral and Research Hospital. We want to get the final talks, the final thoughts of our experts in studio this evening as regards the latest technologies in cancer diagnosis and treatment. To you, Bwana CEO, Mr. Ahmed Dagane, let's talk about the cancer burden in the country. We've had our panelists in studio, the cancer survivors and the persons in palliative care, talking about how huge the cancer burden is in the country. Is this facility able to cater for the demands of the patients that come here seeking treatment? What can you tell us about possible waiting lists and indeed the demand in terms of numbers of the patients that come here?
Thank you. Thank you, Ms. Muli. It's good to be back to further discuss on the big conversation tonight. As I talked about earlier, we are seeing an increased number of cancer patients. I've said earlier, we're treating between 800 to 1,000 patients a day in our specialized clinic, and most of those patients are cancer-related patients. And so, as a hospital, we thank the government through the leadership of our cabinet minister, because this is a highly specialized institution that is able to mitigate some of the gaps that we have in the country. But we're trying. We are treating patients for radiotherapy. We have seen those increased number of patients, and it has forced us to start a third shift. So instead of having 2 shifts, now we have an additional shift.
So you run the radiotherapy for 24 hours?
Yes, we do run for 24 hours. Of course, there's a waiting list, but again, through the leadership of the cabinet secretary and the hospital board of management, we're going to acquire a second LINAC machine very soon to be able to take care of those patients. So we are doing our best as a highly specialized hospital to be able to mitigate some of the gaps.
In terms of the waiting list, we know that there are stage 4 cancer patients who do not have the luxury of time. So in terms of the waiting list, do you prioritize in terms of how advanced the cancer is?
Absolutely, absolutely, yes. Those patients who are really sick are prioritized. And then we also, we do have daily clinics, so some of the patients are being seen. There are also other treatment modalities going on. We have the oncologist specialist here in the hospital. They're able to see those patients and prioritize according to how sick they are.
Right, and as I proceed with the rest of the panelists, advancements in terms of research, you say you have a huge cancer burden in terms of a waiting list and not enough equipment to cater for the demand as well. So advancement in terms of research and where you are at as an institution.
Yes, thank you. A great question. As an institution, actually, we have a robust research activities going on in the country. We have excellent partnerships that we have incorporated. An example is there's an ongoing research through a partnership with the University of Manchester and the Christie Hospital Foundation in the UK. We have done a joint grant together on esophageal cancer. So that is one of the cancers that are researches that are going on. And then, of course, we have partnered with local institutions like Cambridge. There are several research studies going on in the institution. And so through partnership, collaboration with both local institutions and some of the leading healthcare organizations across the globe, we have a robust partnership. In fact, as our name suggests, we have a whole directorate in charge of research.
Thank you for that. Now, Dr. Helena, we had spoken about the breast cancer comprehensive care that is found here, and I'd like us to go back to that issue as regards how timely it is in terms of when you get the results and what exactly happens in that particular center.
So we have the Comprehensive Breast Care Center, which is a novel idea in the country, was launched, it's just about a year old now. And we're able to cater to both men and women who have got breast cancer or breast care concerns. And so it's a rapid results initiative clinic, and we're able to make a diagnosis within 60 days and initiate treatment as well within that time. I think we're doing better than that target that we were given of 60 days, and we're diagnosing and starting treatment earlier than the 60 days. And we're able to do everything. So we're able to screen our patients. We have ultrasound, mammogram, MRI. We have got pathology services available where we can be able to get the biopsies done We also have got nutritional support, we've got counseling support, we have an active support group where we are able to cater for those that are survivors and those that are going through the journey with breast cancer, to be able to, get some strength through others that have made it. And then we also have palliative care. And then with the other treatment modalities, we're able to offer chemotherapy, immunotherapy, as well as radiotherapy to these patients. We also have 2 dedicated breast surgeons and are able to offer specialized breast surgery for these patients.
Right, and on the other leading cancers as well, which would be the cervical as well as the prostate, do we have any advanced technology that patients can find here?
Yes, just touching on cervical cancer, we have a screening program. It's unfair to have a woman walk in and only screen for one cancer. So we're able to screen not just for the breast cancer, but also cervical cancer. We know that these are the 2 leading malignancies in women and also the highest cause of mortality in terms of cancer deaths in the country. And so we do offer cervical cancer screening. And for those that have early lesions, we're able to treat them in the pre-invasive stage. Those that are diagnosed with cervical cancer, we have a gynae oncologist available in the team, and we also have treatment options available. For prostate cancer, we have diagnostic facilities where we have the PSMA PET CTs that is specific for prostate cancer, and we do have options to treat the prostate cancer as well, including the CyberKnife.
And Isaac, elaborate on the affordability of cancer treatments and medication found here, because affordability continues to be a huge concern, as you've had from our cancer survivors in studio and those that are still undergoing treatment. In terms of the NHIF, will it be able to cater for patients that are referred here, and in terms of future visits as well? Is any Kenyan from across or even far-flung counties across the country able to access treatment here? And if not without the NHIF, will this institution be able to cater for the Mwananchi?
Thank you once again, Lillian. Yes, we are a national referral hospital, and we are open for referrals from all over the country. Just to let you know, majority of the patients we see at the Molecular Imaging Center and our Oncology Center actually don't even come within the counties around Nairobi. They come from as far as Garissa, Kisumu, Nairobi, Kisii, Nakuru, just to come and get these specialized services. And I'm glad that our National Health Service Fund is able to support especially this complex treatment. I'll talk about the Molecular Imaging Center, where they do PET scans, and the most recent one, the CyberKnife. We have I just want to mention that recently they also included brachytherapy, because initially it was not being covered by NHIF, but after discussions with them and also with the input and the support of the National Cancer Institute, we have been able to convince NHIF to include that, because it is an important modality of treatment as part of cure for cervical cancer.
Right. Gentlemen and lady, I thank you for your time. Very quickly, Keflom, the importance of early diagnosis as we hand back to studio. The rain is not on our side. Let's get your final thoughts very quickly. Inform us on the importance of early diagnosis and how far this goes as regards better treatment outcomes.
Yeah, thank you very much for the question. So the importance of early diagnosis is that, like, if you could be able to detect the cancer early, which means there is a probability of getting cured. So being part of the Integrated Molecular Imaging Center as a nuclear medicine physician, our imaging facility also has a role in detecting those cancers early, so that they will get early treatment. So, which means early detection of cancer means getting the probability of being cured from the cancer. Yeah.
Many thanks for your time once again, gentlemen and lady. We've been coming to you live from the Kenyatta University Teaching, Referral and Research Hospital. Remember, it is a referral hospital, but with your NHIF, you can get treated here. Do not also stay away if you do not have an NHIF cover or card. Simply walk in and you'll be advised on how to go about getting treated here. Remember, this institution made history after performing the first non-invasive cyberknife surgery, and it is a first of its kind in this region. Back to you in studio.
Great, thanks so much for